Good afternoon. I'm Assistant Chief Jeff Happ. I want to thank all of you for coming out today. This is a great day for the residents of Columbus. These two new vehicles behind us will allow us to provide better and more timely care for the individuals in our community who have been afflicted by the opioid epidemic. I would like to thank the Safety Chair, Councilmember Brown, and the rest of City Council for their support in providing funding for these much-needed resources. And with that, I would like to introduce Lieutenant Matt Parrish and Lieutenant Dennis Jeffrey to talk a little more about the program.
Thanks, Chief. As I stand here at the firehouse where I spent the bulk of my career providing paramedic coverage and services to the community, I think that folks may see just two fire SUVs behind us. But what I see is a change in the future of the way we deliver service in the community in a non-traditional way. This isn't only going to benefit the folks that are dealing with the opioid epidemic, but it's going to benefit the entire community because it's going to free up regular crews to respond to more normal traditional calls. So I think what you see here before you is the beginning of the way we deliver service in the community in a non-traditional way to get the right resource through this co-responder team of all of the different agencies that are standing up here with us, which to date is over 6 agencies that have partnered in this program. So with that, I'll turn it over to Lieutenant Jeffrey.
Well, thank you. As Matt said, it's been an honor and a privilege to be part of this team. As you can look behind me, this is really a true team concept. I've been a police officer for 25 years, and until a couple years ago, we went on a lot of runs with fire, but we never really were a true team. So now this is really taken to this next level and really brought a lot of skills together, people that typically wouldn't work together now, but the community had a need, and these folks behind me stood up and met that need head on and are doing a fantastic job. So like I said, it's a real honor and privilege to be part of this team, and we really think these vehicles are going to be a great asset to the community.
And next, Chief O'Connor.
Good afternoon. One of the things that you see behind here is the ultimate in cooperation among city agencies and county agencies. What you see here is an organization that got founded about 1.5 years, 2 years ago, started making runs because of the opiate epidemic that's going on in Central Ohio and around the world. What you see here is now a cooperation of both the Columbus Division of Fire, the Columbus Division of Police, Central Ohio Area Agency on Aging, the Prosecutor's Office, Southeast Mental Health, other agencies, the Adam H. Board provided the funding, the grant funding. What this is going to do is allow the City of Columbus to continue to provide the solution instead of just treating the symptom. That's what we see as a difference in change of what this group does. In the past, we would go on runs multiple times, maybe to the same address for the same individual because they were in crisis. We had no other mechanism to help them other than to transport them to the hospital. Now with this team, not only can we get them that immediate treatment, but we can solve the long-term solution, and that's what this team can do. The cooperation among all the agencies is insurmountable, and we want to thank everyone for their cooperation. We thank you for the funding. Councilmember Brown, who I'd like to introduce now, has spearheaded this organization in providing the support that is needed to be able to provide the outreach here in Central Ohio. Councilmember Brown.
Thank you, Chief O'Connor, for the introduction, but also for your vision in supporting the work of these first responders. When I was approached by Assistant Chief Happ and Lieutenant Parrish to invest in new vehicles for their team, they knew the answer would be yes, because I'm a former paramedic. I've always been sensitive to EMS, and I'm proud to support the life-saving work of the Rapid Response Emergency Addiction Crisis Team. While EMS historically has rushed to the scene of an emergency, stabilizing the patient and transporting them to the closest hospital, REACT is rethinking EMS by taking a compassionate and responsive approach to treating the disease of addiction and transporting patients to the appropriate medical facility. I commend the Columbus Division of Fire for recognizing the increased impact of overdoses on our community and their burden on the EMS system. I applaud the Division of Police, Lieutenant Jeffrey, the Adam H., Mary Haven, Southeast Healthcare for their partnership in this initiative. Yet another example of the Columbus way. REACT is the only collaboration of its kind in the country and has been recognized as a national best practice in addressing the opioid crisis. Recently, one of Ohio's United States senators recognized REACT on the Senate floor. His saying was, "REACT is one of the best in the country at closing an obvious gap for those that suffer an overdose by following up and offering help." These comments exemplify what residents of Columbus already know, that our first responders are some of the best in the country. My desire that when the community sees these vehicles, they will feel hope, and I want those who are struggling with the disease of addiction, along with their families and neighbors, to know that their community cares about their recovery. When you call for help, know that help is available. Thank you, and that concludes our press conference, and the rest of us are available for questions. Take care and good afternoon.